At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend breast thermography and early detection on Wednesday, September 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Welcome to Dr. Tom Roselle Live. And guess who's here? It's Dr. Tom. Hope you're having a great Sunday. It's going to be another hot day, and it looks like we're going to get into that next few days through the week. But nevertheless, I'm here to cheer you up. Well, maybe. I got a lot of data for you today that you need to know about, but perhaps knowing about isn't enough. So we're going to kind of move that from this program into the live stream immediately after we do the radio program on WMAL 105.9. And we're going to be talking a little bit later on natural remedies that have to do with breast cancers and things that are out there, just things that you need to know are available to you that you can check out and see the effectiveness of them. And I'll point you in the right direction. But we're going to get into a little something today that I was kind of over the top overwhelmed with, not so much overwhelmed, but oh my God, finally somebody's saying it. I was at the national convention 2 weeks ago in Florida, in Orlando, that was sponsored by the Florida Chiropractic Association. I may have mentioned it just a little bit, but there's a few more things I want to share with you. And I want you to understand what's really taken place over a period of time post-COVID. We've been talking about breast cancer, and we're going to talk a little bit more about the next 2 weeks leading up to September 11th, 11th, at the Roselle Center for Healing in Fairfax. We're going to be doing an in-house presentation on thermography, thermographic imaging, and the identification of breast cancers and other cancers. Dareth Painter, the principal in thermography centers of Fairfax and thermography centers of Virginia, will be presenting, and she'll be talking to you about the thermographic camera and things of that nature. And I'm going to be throwing a little tidbits. We're going to be talking about a little bit of hormone disruptions and what happens. We're going to talk about a little bit of cures that are available and so forth. But we're going to join that. And, we're looking at thermographic imaging as in my opinion, one of the most powerful tools out there that you can use to make a difference in your health relative to diagnostics and so forth. So let's get it a little bit to the program and kind of float back to what we were talking about, or I was talking about, the information that I was exposed to. There was a professor out of Harvard, and this professor, his name is Dr. Herbert Ley, L-E-Y, and interesting guy. He's former commissioner of the US FDA. And he made a comment back in 1969. And I want to quote this because it kind of lays the foundation for a lot of what we're going through right now. We're seeing, as in my opinion, is going to get progressively more present. So let me quote him. The FDA, Federal Drug Administration, protects the big drug companies, and it's subsequently rewarded. And using the government's police powers, they attack those who threaten the big drug companies. People think that the FDA is protecting them. It isn't. What the FDA is doing and what the public thinks it is doing are as different as night and day. Did you get that? Did you hear that? Look this guy up. His name is Dr. Herbert Ley, and he was former commissioner of the US FDA. And this comment I'm reading goes back to 1969, a whole lot of years ago. So was he insightful and predictive and hallucinogenic, or was in fact, having been in the position that he's in and having the credentials that he has, was he really straight up? And did he know something that we didn't know? It's kind of creepy when you think about that, but it's also, it's not only just, as I said, creepy, but it's scary as all get out when it comes to what we're seeing today. So let me kind of throw the blanket on or uncover the veil, if you will. What happened over the last 5 years, 4 years, 5 years, actually a little bit more than that, with the SARS-CoV-2 infection? I want you to know what happens and why we're seeing so many what we call turbo cancers, why we're seeing more breast cancers and prostate cancers that we've seen in probably forever, and what the common link is. And it's kind of interesting. And I'm going to give you some of the side effects that also show up with the post-COVID period, if you will, and they're just kind of jumping out of us all over the place. And more importantly, if you follow me into the live stream, as soon as you go to drtomroselle.com, and there'll be a spot there. You just click the button, go live stream, and you'll get to see this crazy face of mine. And we're going to talk to you about some other things. So SARS-CoV-2, and I took a lot of notes when I was listening to the speakers, and what it says, it hijacks the human cellular factors in the body. And they talk about something called NRP1, and it's neurophilin 1, and it gets in and it starts doing all kinds of stuff. But here's what happens. It goes into the neurocognitive system, the nervous system, brain, spinal cord, all the little tentacles, and it supports these little areas called astrocytes and the neural junctions, if you will, in their expression. And what happens is it disrupts it. It gets in there and binds it and disrupts the heck out of it. Now, the next piece, it goes in and not only affects that, but it affects the endocrine system. And so subsequently, you got signaling that is backed up. So it kind of invalidates the signal. The body doesn't receive it the way it's supposed to. And all the way down to gonadal tissue. That means your ovaries, your uterus, the testicles, guys, and young men having erectile dysfunction problems across the board. So when you understand, there's a lot of things that are showing up in our environment. Young men coming into our office and we do blood work, and they have testosterone levels, as I've said in previous programs, somewhere around what you would expect to see in somebody who's in their 80s and not in the greatest health, and they can't impregnate their partners, their wives, and we're seeing all kinds of miscarriages and things of that nature. Now, in addition to that, the liver's affected, and what we're seeing is an accumulation of heavy iron within the blood and within the liver. And that leads to some of these really ugly plaquing events that many people are talking about. I think I've mentioned to you that during the scare of COVID, and say, well, we're seeing all these plaques and they're coming out of nowhere and we don't recognize them. So what do? I pick up the phone. I call a good friend of mine in Western New York who's a undertaker. And I asked him a question. I said, hey, man, I said, this is what's out there. Is it true that, these things are showing up? And he said, Tom, he said, look, he said, we're seeing things that we've never seen before. And we're actually trying to encourage people to either cremate if they were considering embalming and burial, or to bury immediately. Just, we put them on ice and make sure they don't decay. And because we can't get the preservative in the body and we can't get the blood out like we used to, it's too thick. It just won't go. So that's kind of interesting. That's his opinion. That's, again, one man's opinion, but somebody that I trust. So when you get into the mix of this thing, what we've seen is the SARS-CoV-2 was reprogramming the human genome. And that's what we know now is it's passed on if you are lucky enough to get pregnant, if you have been able to become gestational, then guess what happens? Then it goes to the child. it doesn't stop with you. It goes into the child's genome. So it reprograms the human genome, your DNA, and it reprograms human bioenergetic machinery. That means everything that makes you you, everything that expresses you, and everything from lipid metabolism, and it pairs your innate immune system. That's why so many people, and particularly if they've had the vaccines, are getting sick virtually from all kinds of things. And it shows up with, this this cognitive brain fog, headaches, anxiety, depression, that shows up. We're seeing patients with pulmonary and cardiovascular problems that just don't want to go away. Not only the arrhythmias, but the palpitations and the heart failure and the chest tightness. And we've been able to help a lot of people by working with the nervous system and allowing it to reestablish itself, and seems to make things a whole lot better. Even the sensory pathways. We all knew during the middle of COVID, people lost their taste. But how about the tinnitus, the ringing in the ears, the loss of smell, and then the habitual, chronic, never goes away sore throat. Almost, if you initially got it during COVID, you felt like your throat was raking with glass. And then we're seeing diabetic conditions that really shouldn't show up. We're seeing thyroid problems. We're seeing adrenal patterns. And then the pituitary is like it goes to sleep. And pituitary is a major gland that it tells thyroid what to do, your adrenal system what to do, your ovaries what to do. It tells your testicles to make sperm and increase the testosterone levels and so forth. And then, the blood clots that we talked about and so forth. So this is nothing to kind of set aside, oh, it'll go away, because it's not. It's a gift that's continued to give. And then we're seeing patients that come in and they're going into kidney failure. On most blood work, you're going to see if the what they call the GFR, or the glomerular filtration rate, is above 60, most physicians say, well, that's okay. Well, it actually, first phase of kidney failure starts under 90. And so in my world, we want them up as high as we can possibly get them. But what we're noticing is that there's more and more breakdown in kidney filtration and tissue, so forth. And all of this seems to be finger pointing. And then we see all these skin lesions. I was just about to say dermatological lesions, but from hair loss, alopecia. Don't look at me. My hair's been gone since I was, 19 years old. So I'm not the guy that you're going to point the finger at. But tinnitus and neuropathic problems and skin rashes and increase in fungal formation in the body. All these things have increased. And then we're seeing these subcategories of, the different viral expressions. There was an interesting, he started, this doctor that I was listening to at the national convention was talking about the percentages of these subphenotype expressions. What we're talking about is the things that people are sick with. And he said that 32.8% had cognitive and respiratory problems. That's a big number, right? Then he went on to say that musculoskeletal pain, and often due to the activation of underlying problems like Epstein-Barr virus, like cytomegalovirus, like herpes, and so forth and so on. He said about 23.4% of the people end up with that. And then he said gut problems, and because yin yang, the large intestine, works with the lungs, we're seeing about a little over 10%. Now, if you look at a map, if you will, and you can get this actually from the FDA, they just don't want to tell you about it, where the heavy levels of all these diseases come from, you'll find that if you go viral induced HMR/D, major global health crisis, that's viral induced HMR/D, major global health crisis, you're going to see the concentrations. Now, I wish we had about 3 hours where I can really pick this apart for you. But it's critical that you understand that immune system is crashing. Prostate and breast cancers are on the rise. Sarcopenia, which is the deterioration of muscle, mass is on the rise because of everything that we've gone through. Fortunately, there seems to be some things out there that can make a difference. And the thing that I want to make sure that you understand is don't succumb, get sucked in, manipulated by the drug companies, because I think, my opinion, they have an underlying agenda like some other people do, and we have to make sure that we understand that we have to be our own health advocate. But the life expectancy globally throughout the world has declined since all this happened by 3 years, 2.9 years. And it's the first time we've begun to go backwards. That's not okay. So if you're sitting there and your brain is not working the way it's supposed to, the electromagnetic expression, the energy of your brain is not doing what it's supposed to be doing, because you remember I said earlier the receptors are being affected. So we have to understand that there's things that are existing now for the first time ever, and we have to know more about them. And we're at the Roselle Center for Healing, we're trying very hard. There's a long COVID initiative that just came out from the United Nations, and they're not my finger pointer normally. And there's an ambassador. His name is Professor Dr. Chin Kun Wang, W-A-N-G. He's from Taiwan. He's the head of this thing, and they're trying to put all these puzzles together. They know about them, but now they're kind of being pushed to do something about them. It's important that we understand. And I told you I had the pleasure of meeting Dr. McCullough, a brilliant medical physician and researcher that put his personal reputation on the line to let people know what's going on and what they need to do about it and so forth. So I would encourage you to start doing your homework. And remember, on September the 11th, we're going to have an interesting night. We're going to sit there and we're going to really give you the truth. Dareth is going to show you how to identify breast cancers, at least finger pointing suggestions. She's going to tell you that the thermographic image, if you will, is not purely diagnostic. Why is that true? It's because it doesn't show the mass, the tumor. But what it does show, and it shows it early, up to 8 years before, is the formation of the blood supply that the tumor needs to grow. So that's why it's so critical. We use it and we see something. The next step is ultrasound and MRI, and none of those have radiation in them, which is an important piece. If you're going to diagnose this, don't add insult to injury. We know that radiation is problematic. We know that when you do mammography, where you take gentle breast tissue and you crush it with 45 pounds of weight, and then you radiate it, that is potentially carcinogenic. But in addition to that, then the doc sends you for what? Biopsy. Then if they go in with a needle and they pull the needle out, and if there is a metastatic tumor or there is a cancer there, it will seed into other healthy tissue. It's known to do that. You go in and check the information out in Europe, go to the British Medical Journal, go to Nature, go to the the FDA journals and so forth. There's tons of data there. It's only available if you go look for it. If you don't look for it, they're not going to tell you about it. So be your own advocate. Remember my book, Ageless Health, Health is a Do-It-Yourself program. And by the way, did you know that you could get that book on Audible? If you went in and you look for it, go Ageless Health, and you'll find that there and under my name. And it's good old me narrating. I think you'll enjoy it. You can download that, and we still have hard copies of it. We have a new updated version that we're in the mix of, but get that, and you can hear me twicking in your ear on an ongoing basis, reminding you to that here's how the body works. This is what's necessary. This is what you can do about it. Make it happen, because look, my friends, you have to be your own advocate. If you don't, nobody else will be, and you have to make sure that you have all the information, not just one side of the information. When we go into the program on the live stream, just in a few minutes, we're going to talk a little bit about the things that are available in a natural world, the things that are out there that you should know about so you can make the right decision. If I said things like Panicure to you and ivermectin, you may have heard those before. They're antiparasitics, but could they be a fix in certain types of cancers? I'm going to let you decide that information when we talk about it earlier. So when we do that, I'm sitting here at the office. I got a kind of an interesting toy that I bought, and I'm going to talk to you a little bit about that. Don't know. We're going to do an in-house research study and kind of, click things off and see what happens and see how it affects, certain conditions and the like. It's just purely research. It's my interest. You know how I am. I get a little off the Richter scale occasionally to just see how things work. But, at the end of the day, please understand that if you don't step up and do your own research on this, and you just listen to all the garbage that's out there, first of all, ask the question. Please ask the question. Whatever you're being told, not only is it the truth, but what did they have to gain by putting that out there? And then the third piece is follow the money. Where's the money going? Who paid for that presentation? How much, ka-ching are they putting in their pockets? I don't know about you, but, having grown up, from immigrant parents, I kind of look at things a little differently sometimes. And it helps understanding that you need to question everything. Don't take anything at first value unless it's you making that decision. Making sure you make that decision. We're coming up to break. I want you to follow me on Ageless Health live stream. Go to drtomroselle.com and click the button. Let's do it now. And we're going to give you a little different look at what things are and how they can be done. I promise you, there's a lot out there that you need to know about. And remember, I do this program for one reason only. You are the best. You are entitled to information. You are everyone that, if you will, should not be duped. Put it that way, right? None of you should be led astray. None of you should be manipulated. None of you should be told lies. I'm going to tell you the truth. Always, every time. Remember, I love you all. I'll see you in a couple minutes. Join me on live stream.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend breast thermography and early detection on Wednesday, September 11th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.